Today on the Happy Food series, we're going to talk about omega-3. Omega-3 is an essential fatty acid, meaning that the body does not naturally produce omega-3s. So the fatty acid needs to be consumed from outside dietary sources. The three main omega-3 fatty acids are DHA, EPA, and ALA. DHA and EPA are found in fish and other seafood. Also, DHA is in algae and spirulina. ALA is found in plants like in flax seeds and walnuts. However, ALA must be converted into EPA and DHA in order for you to get the health benefits. This does happen in the body, but not very efficiently. It is estimated that less than 10% of the amount of ALA you consume is converted to EPA or DHA. Therefore, taking fish oil may be a good option, especially for those who don't eat much fish, but are still looking to gain some of the health benefits of omega-3 fatty acids. Omega-3 has many benefits. Eating fish that are rich in omega-3 fatty acids has been shown to reduce the risk of developing coronary heart disease in healthy people. The American Heart Association recommends 2 servings, 3.5 ounces of fish per week. Omega-3 found in fish oil may alleviate symptoms of arthritis by suppressing the immune system reaction that causes joint inflammation. It may decrease the risk of depression and anxiety, and others are being studied, such as it may reduce ADHD symptoms and help with brain health in adults. Omega-3 plays an important role in brain health. Healthy brains and nerve cells depend on omega-3s because your brain is mostly made of fat. The brain is 60% fat. Omega-3 alone makes up about 15 to 20% of the cerebral cortex, an area of the brain responsible for memory, language, creativity, emotion, and attention. Deficiency symptoms of omega-3 include fatigue, mood swings, memory decline, and depression. Studies show a correlation between consumption of fish with high levels of omega-3 fatty acids and a decreased risk of depression. And also, countries with diets rich in fish have lower rates of depression. And this is a chart that shows increasing levels of omega-3 fatty acids in fish from left to right, with the right containing most omega-3. And fish that contains the most mercury is towards the bottom of the chart, which we should avoid. So the best choices of fish with omega-3 are in the upper right corner, like salmon, mackerel, and herring. Not only can you get the benefits from eating fish high in omega-3, recent reviews of clinical studies conclude that taking fish oil supplements improve depressive symptoms in people with depression. They did a study where British scientists gave a group of patients with stubborn depression a daily dose of EPA. After 3 months, over 2/3 of the group reported a 50% reduction in their symptoms, particularly feelings of sadness and pessimism, inability to work, and sleeplessness. Anxiety is also a quite common disorder and is characterized by constant worry and nervousness. Research has shown that when people with depression or anxiety start taking omega-3 supplements, their symptoms improve. For people who struggle with more complicated psychiatric disorders, low omega-3 levels may be partly to blame. Studies have shown that omega-3 supplements can reduce the frequency of mood swings. Supplementing with omega-3 fatty acids may also decrease aggressive behavior. There was another interesting study done where they gave omega-3 and multivitamins to prison inmates, and their antisocial behavior, including violence, fell significantly compared to those on placebo. Most American diets contain too much of another group of essential fats, which is omega-6. Omega-6 is important too, but there needs to be a healthy ratio of omega-3 and omega-6 in the diet. Omega-6 is in vegetable oils like corn oil, soybean oil, and many processed food, and it's crowding out the omega-3s. The ideal ratio between the two fats, omega-6 versus omega-3, would be 2 to 1. However, the overabundance of omega-6s in the average American diet makes that ratio look more like 20 to 1. So it is easy for us to get plenty of omega-6 in our diet, but many of us need more omega-3 in our diet. Food sources of omega-3 fatty acids are found in salmon, flaxseed, walnuts, and chia seeds. According to the Food and Nutrition Board of the U.S. Institute of Medicine, the adequate intake of omega-3s per day is 1.6 grams for men and 1.1 grams for women, for adults 19 years and over. The U.S. Food and Drug Administration has set a safe upper limit for the intake of omega-3 fatty acid supplements at 3,000 milligrams per day. There are no official recommendations regarding how much omega-3s from fish oil you need to take to see the benefits in brain function and mental health. The amounts used in research varied from study to study. Taking about 1,000 to 2,000 milligrams of omega-3 fatty acids from fish oil per day may be a good place to start. Your daily dose should not exceed 3,000 milligrams. There may be times when supplementing with omega-3s makes sense, certainly for people who do not eat fish or have a hard time consuming enough of the other foods that are rich in omega-3. Although fish oil is typically praised for its benefits for heart health, it also has incredible effects on brain and mental health that are worthy of some attention. So whether taking a supplement, eating fish, or adding chia seeds to yogurt or smoothies, increasing your intake of omega-3 fatty acids may help combat depression and has many other benefits. If you'd like to read more about other happy foods, you can visit my blog at angelapaulsjoan.wordpress.com.